Hi, Sherry. I'm Erin. I'm a psychiatric nurse practitioner student, and I understand this is your first time in the clinic. Is that right?
It is, yeah.
Okay. So I'll be doing your initial intake today. I have a lot of questions for you. You can tell me what's going on. The whole interview will probably take about 20 minutes, give or take. I have a lot of questions that might seem kind of silly or might seem like you're not sure what does this have to do with what I'm here for. But they're things that I ask everyone. It helps me get a whole picture of what's going on. So don't be alarmed if I'm asking you something that doesn't make a lot of sense. So why don't you just tell me a little bit about why you're here, who referred you, what's going on, what you're hoping to accomplish today.
I was actually referred by work. I've been seeing the EAP, having some problems at work, missed some work, and the EAP counselor told me that I should come see you because what we were working on together just wasn't helping me.
Okay. Where do you work?
At St. Aloysius at the hospital.
At the hospital? Okay, what do you do there?
I'm a nurse.
Okay. Up in the hospital?
Yeah.
Okay. So how long have you been seeing the counselor through the EAP?
About a year and a half.
Okay. And had you felt like that was helping you at all, or did something change recently that brought you here today?
I didn't think I had a problem. I thought I was just tired and wasn't really getting myself to work very much.
Mm-hmm.
And then after so many call-ins, they made me go. And then I guess we just started visiting. It's not getting any better. The anxiety, I worry, just can't focus.
Okay. So now you said you've been calling in a lot to work.
I had been. I'm trying, but
okay.
It's just...
Like how many times, let's say, in a month?
I didn't think it was as much as they said, but I feel like it was only a couple, maybe.
Okay. And do you like your job, or how is your...
Sometimes going? It's the co-workers, they never help me, and or I don't think my boss likes me very much. I worry my boss doesn't like me, but...
Okay. How long have you worked at St. Aloysius?
10 years.
Okay. Had you worked anywhere prior to that as a nurse?
Here and there a little bit.
But this one pretty consistently. Okay. So tell me a little bit more about the symptoms you've been having the last year and a half, you said.
I have a hard time focusing, concentrating. I cry easily. I haven't been sleeping. I feel kind of heavy in my chest. When I first thought maybe there was something wrong with my heart or something was wrong, but I just feel anxious and then can't get myself moving.
Okay. So now you said you were worried it was your heart. Do you have like a general nurse practitioner that you go to, or?
I had seen someone,
Okay. And they determined it wasn't your heart?
Yeah.
Okay. Does anything seem to make your symptoms better that you found?
Not really, no. Sometimes I'll have a glass of wine or two, and that seems to help me sleep a little better.
Okay. How about, does anything seem to make it worse?
It just comes and goes. I don't know.
Okay. Do you feel like this every day, or do you have some good days, some bad days?
Kind of a little nervousness every day at least.
Okay. Are you presently on any medications for your symptoms?
I take a thyroid pill.
You take a thyroid pill, okay. And do you know the name of it?
Synthroid.
And how, do you know the dose?
I think it was 75 micrograms.
Okay. Now, have you had your thyroid level checked recently?
I did, yeah. I had a physical about a year ago.
Okay. And everything was normal as far as your dosage and that? Okay. Why don't you tell me a little bit about, like, your home life? Are you married?
I am, yeah.
Okay. And do you have children?
No.
Okay. And how long have you been married?
15 years.
Okay. So tell me a little bit about your relationship with your spouse.
It's okay.
Okay.
He's good to me.
Okay. No problems there necessarily?
No, I don't know.
Does he know you're here today?
No.
Okay.
I don't think he'd understand.
Okay.
Or he would think I'm crazy or something.
Has he noticed anything different in your demeanor, or?
I think he just thinks I'm sad all the time. I think he's probably tired of it.
Okay.
So I'm worried maybe he's gonna leave me or something bad's gonna happen.
Okay. Do you feel sad or depressed much of the time?
I just don't feel much of anything sometimes. Either I go from that to feeling so nervous and worrying.
Okay. Do you feel hopeless ever?
I don't know if I'm going to get any better. Does that count?
Have you ever had thoughts of hurting yourself?
No, not really.
Okay. Suicidal
No.
thoughts? Okay. Have you ever had any thoughts of hurting someone else?
No.
Let's see. Talked about how you're feeling sad, anxious. How about some people? Have you ever cut yourself? Like some people just cut themselves, not to kill themselves, but to
No.
hurt themselves. No. Okay. Do you ever like hear sounds that aren't there, or see things that aren't there?
No, I don't think so. I think it's just I have so many thoughts in my head all the time. Just
It's like racing thoughts. Would you
Yeah.
say? Okay. Any history of any trauma?
No, I don't think so.
Okay. Have you ever seen a psychiatric provider or a counselor before the last year and a half?
No.
Okay. Have you ever been hospitalized for a psychiatric disorder? Okay. Have you ever been told that you have depression, bipolar, anxiety,
No.
obsessive compulsive,
No.
eating disorder?
When I was in high school, I probably had a little problem, but
Okay, just tell me about that.
I just lost a lot of weight. And,
Were you trying to?
I think school was just hard and I was busy and I think maybe my mom she tried to take me someplace and I just didn't want to go.
Okay. And since high school?
No, I think it's better.
Okay. Are you satisfied with your weight now?
Oh, I'd like to lose some more weight.
How about personality disorders? Has anyone ever told you you have that? Or psychosis, psychotic disorders? Do you have a lot of tattoos or any tattoos?
A few.
Okay. Have you ever been violent or aggressive to others?
I don't think so. Sometimes I get mad at my coworkers, but I don't think I'm violent.
Okay. Let's see, you said you're on the Synthroid. Are you on any other medicines?
No.
Do you take any vitamins, any over-the-counters, herbs?
No.
Okay.
Sometimes I take that melatonin.
Okay, for sleep?
Yeah.
Okay. Just once in a while, or?
Yeah, once in a while.
Okay, does it help?
Not really.
Okay.
It doesn't seem to help.
Do you know the dose? It's usually 3 or 6. Or...
Sometimes I take a couple of little pills.
Let's see. How about tobacco? Do you or have you ever smoked?
I don't smoke.
Okay. How much alcohol do you drink, let's say, in a week?
It's hard to say, I guess. Some here and there to help it. Just makes me feel a little less nervous.
Okay, here and there, so every day, or?
Depends on the week. Maybe.
Do you think you drink more days than not?
Maybe.
Okay. How about caffeine or pops? Caffeine?
Coffee. I like my coffee.
Okay, so how many coffee cups do you drink a day?
6 or 7.
Okay. How about illegal drugs? So pot, meth, huffing,
No.
any of that? Have you ever tried any of those?
No, not really.
Not really, so maybe.
No.
Have you ever been tested for HIV, hepatitis?
No, I'm not worried about it.
Okay. Have you ever been in a rehab program of any kind? Okay, how about legal history? Have you ever been arrested, in jail? No, okay. Are you allergic to any medicines that you know of?
No.
Okay. Are you allergic to anything in the environment that you know of?
No.
Okay. As far as your family history, anybody in your family that you know of that struggles with depression, anxiety, ADHD, bipolar? Okay. Okay. Now, as far as your own personal medical history, you have the thyroid. Do you have a low thyroid, or had you had a surgery, or
Just a little thyroid.
okay? Any other medical problems? So, any cancers, asthma,
No.
heart disease, diabetes, seizures?
None of that.
Okay. Any surgeries?
No.
Okay. Now, you said you have no children, but have you ever been pregnant?
A few times, yeah.
Okay. So, and what happened? What was the outcome of those pregnancies?
Miscarriages.
Okay. So, what's a few?
5.
And when was your last period?
That kind of comes and goes too. A couple months, I think.
Okay. Do you think you skip periods, or?
Yeah, I think so.
Okay. Tell me a little bit about your family background, like your growing up experience.
Just normal farm family.
Okay.
You know.
Mom and dad,
Mom
were
and
they
dad,
split
yeah.
up?
No,
Okay.
they were together.
Any siblings?
2.
And your relationship with your parents and your siblings now?
You know, we're all pretty busy. We don't talk much.
Okay. Do they live in here? Or?
Some here, one's here, one's not. So
Okay.
yeah, just pretty busy.
Okay. Now, on that note, do you live here in town, or do
Yeah.
you live on?
Oh, close to town.
Okay. Okay, so not too much of a commute.
Yeah,
Then.
little commute.
Okay. And you're a nurse, so obviously you've gone to college. And what is your education level?
A 4-year nursing.
4-year
degree.
nursing. Okay. Okay. Have you ever been in the military?
No.
Okay. Presently live with your husband, and that's it, right?
Yep.
No other family or other people living with you. Okay. Have you ever been abused, physically or
No.
sexually?
No.
Do you think you have other support systems? You said your relationship with your husband is good. How about other family members, friends?
No, I really just. I think everybody's just tired of me being the way I am, and I don't go out much. And
Let's see. Talked about your sleep. How about your appetite?
it's okay. Kind of comes and goes.
Okay.
I don't want to get too fat. I don't want. I don't want to.
Okay. Do you feel like you eat regular meals?
For the most part.
Okay. Do you exercise?
No, not really.
Okay. Any problems with headaches, dizziness, visual changes?
No, not really. Just kind of a dull feeling sometimes, racing
Racing
thoughts in
thoughts,
my
or-
head. Some headaches, but not too bad.
How about chest pain, shortness of breath?
I do have that a lot. Feels
Okay.
heavy, and sometimes
Okay.
it's hard for me to catch my breath when I'm thinking about things. And
Okay. So
I
you
can
get
feel my
short-
heart. Yeah, I can
Okay.
feel my heart.
So what do you do when you get those symptoms?
Well, I just try to think about what I can do, and then I think some more. And I try to walk a little bit, but
Okay.
it just
Doesn't seem to.
my counselors told me to try to get out and get some exercise, but then I'm just thinking and worrying about things.
Okay. Okay. Yep. How about stomach problems? Like heartburn, nausea,
And sometimes my
constipation.
stomach hurts. Sometimes it just hurts.
Okay.
Yeah. Then I get diarrhea. And
Any bladder problems?
no,
How about muscle aching, joint pain?
everything kind of hurts. Just kind of.
Any skin lesions, rashes, anything like that? Okay. So what I hear you telling me, I'm just going to kind of go over. You tell me if I missed anything or if there's anything you want to add. But that you've been seeing your counselor through the employee assistance program through work for about 1.5 years because of increasing anxiety, worry, having a hard time focusing, crying easily, not sleeping, some physical symptoms with the chest, heaviness. You do drink a glass of wine now and then to help settle your symptoms. You just feel like you're not wondering if you're ever going to get any better. Thoughts are racing. Am I kind of on the right track? Okay. Okay. Well, based on what you've been telling me, I would agree with your counselor that, I think considering a medication would be beneficial for you. Is that something that you would be willing to consider or try?
Will it have a lot of side effects, or will it work right away?
Right. Well, the one I think based on what you're telling me, you have some symptoms of anxiety with some overlapping depression. So the medication that I would consider giving you is something called sertraline, which we call selective serotonin reuptake inhibitor, fancy name, but it's basically an antidepressant that also works for anxiety. It's not something that works overnight, so you won't really notice its full effectiveness for probably 3 or 4 weeks. As far as side effects, they're usually pretty minimal. Some people can get some stomach upset from them. Usually, if you do get that, if you can stick it out for the first several days, a lot of times that goes away. Most people don't gain weight on it. Occasionally, some people will complain that it affects their sex drive. So that's something to, like maybe you're just not as interested.
Okay.
But then not everybody experiences that either. On the other hand, if you're not feeling good or feeling down, then you're not interested in sex either, and this might actually improve it, if that makes sense.
Do I have to tell my employer that I'm on medication? Does this mean I'm
No,
crazy?
no, this doesn't affect your employment. You can drive with it. You can work while you're on it. Your employer doesn't need to know. Does not mean you're crazy.
I wouldn't fail a drug test if they did that.
No, this is not that kind of a medication. So good question. Yeah, we'd start you just on a low dose, like probably 25 milligrams. And again, like I said, it takes 3 to 4 weeks to reach its effectiveness. So I'd probably want you to come back in about that amount of time, so in about 3 weeks, see how you're doing on it. Does that make sense?
Yeah.
Okay. I think you should continue to see your counselor. Were you planning to do that?
I just don't feel like he's helped me. But if you think that's what I should do,
Okay.
I'll keep trying.
I would continue that. If it's not with the one you are with, sometimes somebody else you have better chemistry with. But just to keep, now that once you get on the medication, start feeling a little better, you might find that you're able to work on some of those things that he has in mind. But just to help you with some insight and coping skills. And then I also want to give you this. This is some crisis hotlines.
Okay.
So, I know you said you're not suicidal or considering hurting yourself, but if that were to change, and you were having thoughts like that, this crisis hotline you can call, like it says 24/7. If it's, during the daytime hours, you can call me as well, but like I said, we're not here, in the evenings or the weekends, so you've got that.
All right.
If need be. So, do you have any other questions for me right now?
No, I don't think so. Thanks for listening. I just feel like I just want to get better.
Okay. Yeah. We want you better too. So I'll send your prescription over to the pharmacy, and you can set up an appointment to come back in about 3 weeks.
Okay.
Okay?
All right. Thank
nice
you.
to meet you.